those who've joined us, thank you so much. We're just going to give it one more minute to let those joining us. Okay, thank you so much for joining us today for our World PI Week special advocacy webinar today. Before we start, I know we start with a land acknowledgement. I would really like to thank Sarah Wolf. I don't know if she's joining us yet, but Sarah, I was really lucky to do a land acknowledgement workshop with, and I was able to take part in this special workshop. So I'm going to just for a brief minute talk about what I learned in this workshop before we do the land acknowledgement itself. In this workshop, we kind of recognized that colonialization and associated attitudes, policies, and institutions have significantly changed Indigenous people's relationship with this land. And for many years, those same things served to exclude Indigenous people from everyday life, including accessing services like employment, education, and healthcare, one of the reasons why we exist as an organization. While there's much to be done to redress the historical and continued barriers facing Indigenous people, the territorial acknowledgement or land acknowledgement is an important part of working together with our Indigenous communities. It can inspire people to think about how they've come to be here, including the impacts of colonialism. It can foster a sense of responsibility to learn more about the people whose lands we live on, wherever we come from. And it can also offer an opportunity to reflect on what we'll do differently based on what we've learned. With this in mind, I'd like to acknowledge that I join you today from the territorial lands of the Lekwungen and Coast Salish people. Immunity Canada acknowledges that from coast to coast to coast, we are all guests on the ancestral territory of the Inuit, Métis, and First Nations people. You are encouraged to consider your own position in relationship to the land where you find yourself as part of improving your own understanding of local Indigenous people and their cultures in the spirit of reconciliation. Today, we're using Zoom. I encourage you to participate if you have a question. You can type it either into the chat or the Q&A function. You can also message us, you can email us at info@Immunity Canada. It's just me today. There's no one behind the scenes. So please feel free to use the Q&A and chat function or the info@Immunity Canada throughout. You don't feel like you have to wait until the end of any of the presentations. Oh, wrong way. Sorry, everybody. We're going backwards. So who we are. We do start all of our webinars with who we are as an organization to kind of view and to ground us and to remind us what we're doing here as an organization. We empower Canadians impacted by immune deficiency disorders to live well through education, support, advocacy, why we're here today, community building, and research. Our vision is all Canadians with immune deficiency disorders have the accesses and resources they need to thrive. And our values are community, equity, inclusiveness, empowerment, excellence, and innovation. Today, our overview, we're going to be looking at what is advocacy on very basic terms, and what the aims and goals are of advocacy. We'll look at some different types of advocacy. We'll look at our organization's advocacy and what we do and what we've done in the past as well as what we're doing now. We'll look at where you can start to get involved in advocacy and how to get involved and what to do. And then we'll look at some tips and tricks as well. All right, so to get started, what does it really mean? What is this thing we call advocacy? And when we talk about, education, support, and advocacy. So the dictionary terms of advocacy is any action that speaks in favor of, recommends, argues for a cause, supports or defends, or pleads on behalf of others. Another definition was public support for or recommendation of a particular cause or policy. But in really, really general terms, or basically, advocacy is an activity or action by a group or an individual that aims to influence decisions or create change. And I think this is really just at the heart of it. If you want to change something or we want to influence something, that's what it is. And that's really what we're talking about here. That's really what the goals of it are. And that's really a lot of the work we do when it comes to it. So we're going to look at the main goals in all of its different forms. We are aiming to ensure that people, and in this case, primary immune deficiency patients and families, have their voice heard on issues that are important to them. And that's what, as an organization, we're here to be the voice of that group of people. We're here to be the voice of primary immune deficiency patients and families, and that people have defend and safeguard their rights. So the rights, in this case, of primary immune deficiency patients and families, their rights are defended and safeguarded, and have their views considered when decisions are being made. You may have heard the phrase that's often used in our sector is "nothing about me without me." And that is something that we hold dear here. And I know that that's really, we need to make sure that primary immune deficiency patients and families' views are considered when decisions are being made about them that impact their lives, obviously, and that patients and families, in this case, have access to information and services. So that's the main goals of advocacy in regards to what we do here. This is very basic overview, but there are three basic types of advocacy. We as an organization work primarily in two, but there are three that I'm going to overview really quickly. There's self-advocacy, which is being able to successfully assert and convey one's own self-interests, needs, and rights. This is not what we do at our level, but you may do that on every day. And we encourage, and we as an organization can give patients and families tools to do this. So this is something, self-advocacy is something you may do when you go to your doctor. We encourage patients to advocate for themselves at their physician's level. You may do this on an everyday level. I don't know if you go to your, if you're a tenant and you talk to your landlord about something, you may self-advocate for yourself in that way. But that's not something that we do as an organization, but we may equip you to give you tools to self-advocate on a different level, like I said, with your doctor. There's individual advocacy, and this can be formal when an organization like us advocates on behalf of a person or a group of people. We do this on a regular basis. This may be a patient who reaches out to us who is unable to access a specific service or treatment at a hospital, or and they come to us seeking assistance. So we do that on a regular basis, but that's just one example. So we do that quite a bit. Or if it's something particular for a group, for a primary immune deficiency group, but it's not policy changing, so we do that as well. Or there's informal individual advocacy, where it's people, friends or family, advocating on behalf of a person. So we don't do that here at this level, but a lot of people we know do that. So if your friends or your family are getting together to do something on behalf of you, or you do this with your friends and family on behalf of someone else, that is informal advocacy, because you're not doing it in the sense of a formal group, you don't have an organization attached to it. Systems advocacy is when you are targeting systemic change in regards to policy, rules, or law. We do that a lot, where we're looking at changing policy to improve policy and create actual change that will continue. And so in this organization, we do formal individual advocacy and systems advocacy primarily, as well as enabling self-advocacy for our members. So let's move on to looking at an overview of some of the advocacy work and some of the areas we actually work in. This is not a comprehensive list, but this is looking at some of the work that we're currently doing and some of the main areas that we've focused on in the last couple of years. Plasma sufficiency and access. I know that World PI Week this week is, the theme is access. And so some of these are, you'll see access mentioned quite a few times. Plasma sufficiency, I know that a lot of you on the webinar today will have heard a lot about. We have done a lot of advocating in Canada and our plasma supply and creating a greater sufficiency in Canada for plasma. To briefly go over it and not spend too long on it, Canada currently only collects, I think it's roughly 15%, I think we're at now, maybe it used to be 13, I think it's 15 now, percent of Canada's plasma needs for its patients, and the rest are purchased on the global market, primarily the US. And we have been a very vocal supporter of Canadian Blood Services' plan to increase Canada's plasma supply to 50%. And you know, that includes opening of plasma donation centers, some of which are Canadian Blood Services plasma donation centers, and some of which are a private company operating under Canadian Blood Services. It has been quite a hot topic in the news due to compensated plasma. However, we feel that, you know, plasma being the product that makes, you know, immunoglobulin comes from plasma. It's so important that our patients have immunoglobulin, and plasma being a resource that is in demand globally at this point, we really do need to increase what we collect in Canada. So that is something that we have been advocating for and working with not just other patient groups, but also Canadian Blood Services. And we do support their plan to increase their plasma supply in Canada. We have, in this work, we have presented and testified at the Canadian Senate, at legislatures in Alberta and in Ontario and in British Columbia. We've had many of our patients and members write letters, meet with their MPPs, MLAs, MPs as well. We've made submissions to Health Canada when they were doing when they were looking at immunoglobulin and patients who use immunoglobulin. We've taken part in global conferences, and as I said, worked with other patient networks who use plasma protein products and immunoglobulin. We've done many media interviews. It's been an ongoing advocacy issue for 10 years, and I don't see it going anywhere for at least the next 10 years. Currently, it's our chair is attending Hamilton City Council meeting on Monday, where the mayor of Hamilton has put in a town resolution to create Hamilton as a paid plasma-free zone, because one of the plasma collection centers is attempting to open a center in Hamilton, and the mayor is trying to stop it. So it's going to be an ongoing issue, and we'll see where it ends up. SCID newborn screening. We have been, since 2014, advocating for the inclusion of severe combined immune deficiency onto the newborn screening panels across Canada. It has been successful. There's only one province left. We started with Ontario. We've gone across the country, and all the provinces except for Newfoundland now screen for SCID. Quebec was the last one to add it. They've added it, but they have not yet started the screen. Newfoundland is a tricky one because they have the ability to test for it, but they have not added it because there is no access to pediatric immunologists who would be able to follow up on the treatment should they catch any babies with SCID in the screen. So that is another issue which we are now advocating for in the follow-up. That's an access to comprehensive care and an access to pediatric immunology. So we've been in talks with Newfoundland. They're happy to add the screen should there be a follow-up to care. So that's a whole other access issue that we need to work with Newfoundland with. Gene therapy, access to gene therapy. We know that there is gene therapy treatment available for a couple of conditions, not in Canada. We are currently working with the provinces and territories, Health Canada, Canadian Blood Services, and CADA, and we know that there's more gene therapy coming, to find a way on how gene therapy would be, how we can create a reimbursement pathway for gene therapy for primary immune deficiency patients in Canada when it is ready to come to Canada. What that would look like, how we can create access for gene therapy for our primary immune deficiency patients, and where all patients would be able to receive it when necessary and how. That's going to be a very long process, and we're not quite happy with where it's headed at the moment, but we will continue. We have some very good patient and parent advocates working on this with us. Access to biologics. We've just started this 2 weeks ago, I guess. There's an issue in a couple of provinces where immunologists are finding that they're unable to access biologics for certain primary immune deficiencies and certain biologics. So we are launching a survey to look at where the access issues are for primary immune deficiency patients in which provinces, and how we can ensure that primary immune deficiency patients are expedited and given use of biologics when needed, and ensure that there's no delayed in treatment. Diagnostics and screening, we were made aware that there's some issues with screening. Certain screens for certain primary immune deficiency patients are not being made available in certain provinces. So we're working with the health authorities in those provinces to ensure that primary immune deficiency patients, for those immunologists, when they request the screens, are given access immediately without delay. That is going to be an ongoing process as we go forward, but it is continued work. Immunoglobulin transition, we are not currently in one, but we've gone through 2 in the last 10 years, and both times have been tricky. Our goal there in our advocacy work is to ensure that when patients are forced to transition from one product to another, it is as smooth as possible with as few complications as possible. And if necessary, patients have medical access and exemption to product of choice. And we're sure that transitions will continue because of the market in Canada and Canadian Blood Services and the way they tender product every 5 years. So we just need to keep that on our radar and see that we can continue working with Canadian Blood Services and Hema Quebec, and that we can continue to transition patients in an effective way and in a way that our patients are the least bit affected. The SCIG shortage, I should have actually titled this immunoglobulin shortage. We've had one in the 10 years I've been here. I hope we don't see another. It was not good, as many patients I know experienced. However, we worked, and our patient community and our members were fantastic in advocating so that primary immune deficiency patients were prioritized, and none of our primary immune deficiency patients went without product through the shortage. So I hope that and actually coming out of the shortage, we now have immunoglobulin management protocol, and primary immune deficiency patients should not be ever go without product, as far as we know. So I think if we continue to advocate for the need, but again, this goes hand in hand with our sufficiency advocacy work. The immunoglobulin home delivery program was a really interesting and hopefully not ending. During COVID, we advocated, and thank you to a lot of our members who advocated with us. This came out of Canadian Blood Services, working with our patient organizations, myself, Immunity Canada, and the Network for Rare Blood Disorder organizations, our member groups there. We were able to get, only in some provinces, we were able to get home delivery for immunoglobulin products. Some provinces were very difficult and did not want to deliver home product. However, we realized and we found out that it is possible to do, and that there is a need for home delivery. And out of this as well, Alberta has now launched a pilot for a hemophilia product. And out of this pilot, we're very hopeful that in a few years, we may have more plasma protein products seeing home delivery. And we're very hopeful that immunoglobulin will be delivered to home. Fingers crossed. It might be 3 to 5 years. It may only be in Alberta, or it may be nationwide, but watch this space, because we know that through that COVID home delivery program, that we can do it. And so we're not going to give up on that one. The comprehensive care program and the comprehensive care clinics, we know, and this is when, and we'll talk about this on a later slide, when members come to us and tell us about gaps in what's going on, we know that, for example, there's no adult immunology nurse in Atlantic Canada. We know that there's no pediatric immunologist in Newfoundland. We know that there's no pediatric immunologist in Saskatchewan. We know that there's gaps in care across Canada, and we need to work together to voice our concern, to address that shortage and ensure that that this is taken care of, and that those clinics have that care that's needed for these patients, and that follow-up is there, and that access to care is available. And then the COVID vaccine priority and access, obviously that's passed, but during COVID, when the vaccines were made available, we ran a campaign that hundreds of members took part in. Hundreds of letters went to health ministers and MLAs and MPPs and MPs demanding vaccine priority for primary immune deficiency patients and priority access to vaccines, and it was very successful. And we wouldn't have been able to do it without our members. Again, this is not a comprehensive list. This is just highlighting a few of the things that we work on in our advocacy issues. Oh, and we have a question, so I'm just gonna. So Manitoba, someone says Manitoba's already done home delivery for SCIG and HyQvia, done in partnership with OnePath. So again, some of our provinces are better than others. Some of our provinces have home delivery. Actually, Manitoba is the only one that has it left. The other provinces, so just a little side note, during home delivery, Manitoba was the first province to have it up and running. I have to say that the head of transfusion medicine in Manitoba, I'll give him a really big shout out. He was great. And he set up a home delivery program with Canadian Blood Services really, really quickly. And Manitoba was the first province to have home delivery up and running. Quebec was second. And he even, in Manitoba, said, we will give you the MOU, what I've done for all of the blood banks, and share it so that all the other provinces can join in, because he found it really easy to set up. So we were really pleased, and we said, thank you so much. But the other provinces, some of them don't work the same way, right? So in Ontario, it may be the LINs or the community hospitals don't work the same way. The blood banks don't work the same way. BC said, I'm not going to be, I don't mind throwing them under the bus. I live here. BC said, no way, 100% we are not doing this to our blood banks. They're already under pressure from COVID. We are not doing this. Whitney got a phone call from the bureaucrat who's in charge of blood here, the blood in BC, and she said, Whitney, 100%, take it out of your newsletter. We are not offering it. Okay, done. But Manitoba's been great. And then when all of the other programs shut down their home delivery, Manitoba kept it up and running. So shout out to Manitoba. They've been really great. Oh, another one. Hi, Jan. Thanks for joining us, by the way. Jan says, are PI patients still able to access the Paxlovid as needed? I know there are now new guidelines. Jan, to be honest, I don't know what the new guidelines are for Paxlovid, and I don't know if we have a doctor on the call. So I'm not sure. I will get back to you on that one though, Jen. I will send that out and get back to you. But keep the questions coming, everybody. Okay, so we have the list and we've talked about some of the advocacy issues that we've been working on and that we've done. So where to go from there? So you may feel really strongly about an issue. It may be one of the ones that I've already talked about, or it may be something completely different. It may be something that I haven't mentioned whatsoever. It may be Paxlovid for Jan, or it may be something else. But you may, what I think is just pick a cause, pick something that you feel strongly about. Maybe it's something completely different, but pick something and reach out and ask to get involved. That's the best way to go, right? Reach out to us if it's about us. If it's about somebody else or something else, reach out to them too. But ask to just give us a call, send us an email, you know, social media, anything, and just say, what do I do? This is the thing I feel strongly about. If it's something that's not on that list, let's say it's something about disability or employment, or you went to a restaurant and you feel like you were discriminated against, for example, or it's about masking. I didn't put that in there, sorry, but it's something completely different. Just, you know, ask, send an email, pick up the phone, call me, and just say, what do I do? How do I get involved? If it's a campaign that we're already running, like it's on that list, chances are we have a letter template. We have a toolkit to get involved. If that's the case, then we will happily send you all of the stuff. We'll send you the letter toolkit. We'll send you the social media toolkit. We'll send you guidelines of like, here's some things you can do. And we'll have the XYZ on how to get started. Oh, wrong way. Sorry, everybody. I'm going backwards. I'm really not, can you tell I don't normally run these on my own? There's no one in the office today. Okay. Then after you get the toolkit, you might be sent to, if it's me, like if it's the like let's say you've chosen the plasma sufficiency, you want to get involved with plasma sufficiency and how can you help with plasma? You're really excited about what you've read about Christine talking at the Hamilton City Council, and you want to get involved with the plasma campaign. You'd be sent to me because I'm kind of in charge of the plasma campaign. So I'd ask you, we'd have a huge chat where you want to get involved, where are you located, what do you feel like? And then we talk about what you do. What are your interests? What kind of skills you have? And if you say to me, I don't have any skills, I'll be like, that's not true. Everybody has something. Everybody's got, you know, even if you are in a choir, right? You've got something going on. So we'd find out where your skills are and how you want to use them. And it may be, I mean, we talked about, you know, media interviews already, or somebody meeting with MLAs or MPPs. And if you're like, you know, I'm really not that kind of person. I really don't like public speaking. I really don't like meeting with people. Maybe it's even you can help with sending letters, or you can help with something behind the scenes, or you can help with anything. Like there's stuff that needs to be done to get these campaigns going, or you can just help at an event, you know, registration desk. You can help with anything. But all of these campaigns need manpower and they need stuff to keep them moving, or else they just kind of die on the wayside. So we're sure that your skills can go somewhere and can help. We need bodies. As I said too, we have letter templates for most of these campaigns. Writing letters is so important. Posting on social media is so important. You don't have to be on social media, but it is important. And letter writing is so important as well. And sharing with friends and family and networks as well. The important part here is repeating it. These type of campaigns, it's very intensive, I guess. We always want to make sure that if you say you want to get involved, that you're engaged, because it is an actual involvement. It's not just like, oh, yeah, I sent my letter and that was that. It takes a lot of work, and it does take work, unfortunately. So some tips and tricks that we talk about, and I guess this is kind of, and we'll get a little deep into this for a second. When you get involved in a campaign, and you just need to be one, if you say to me, I really am interested in, I'm from Newfoundland, I don't live there anymore, but my family's there, and I really want to talk about how we can make sure that there's the newborn screening there. But I also really care about plasma, right? So you want to do both. Yeah, oh my gosh, of course. You want to do both? Let's do both. But the campaigns that we run usually have a message, right? So the plasma sufficiency, for example, our message is very clear. We have, we need to increase Canada's plasma supply for our patients. And that's it, right? And the campaign has an ask, right? We encourage in every campaign and in all of the work we do, we encourage you to share your story. If you don't want to share your story, but we encourage you to make it personal. Why is this important to you? Why is it important to you to take part in the plasma campaign? Why is it important to you to take part in the newborn screening campaign? Why is it important to you to take part in the vaccine campaign? So those things make it personal, and that's what makes these campaigns win, and that's what makes them run. So we always encourage people to include something personal. If it's, it's important to me to take part in the plasma campaign because I use plasma product, or it's important to me to take part in the newborn screening campaign because my best friend's child has SCID, so things like that, or it's always going to be important to include your story and your angle, but stay on message. Don't all of a sudden go 10,000 feet away and start asking for, and we need this, and we also need, please take part in our walk, and please don't forget about gene therapy, and please remember that we also need a doctor here. We have to have, if this is your ask, this is your ask. Include your own message, but remember what the ask is. We mentioned media. I would say we do help. Like if you're interested in doing media, we will give you some little bit of media training if you're interested. People always say whenever I talk to anybody, why don't we have more media? Why aren't there more media articles? Or why isn't media involved? Or why aren't there, I've done so many media interviews over the years, and a lot of it doesn't get printed, or a lot of it doesn't get airtime. And that's fine. We can't, maybe sometimes if it's a story for, let's say, the paid plasma, sometimes the patient story isn't as effective as the blood for money story. But there are stories, sometimes the patient story itself is a lot more effective than the patient organization story. So you'll get a story like our member Ashley in Halifax, or our member Andrea and her son Jacob in Alberta, and their personal story of diagnosis and their journey is much more effective than me talking to a news outlet about what we do as an organization. I would be careful with media in the sense of, if they ask you something you don't know the answer to, just say, I don't know, or don't answer it, and always be prepared to just go back to, again, state a message, because that's always the best way to do it. For your MLA, MPP, or MP, this is something we do need members across the country. We need people in every area to be involved. It's much more effective. MPPs and MLAs, they want to hear from their constituents. They don't want to hear from a national organization. And they will always want to hear from their constituents. The other thing is that if they get 10 letters from their constituent on a specific issue, they're much more likely to bring that up the ladder than if they get one letter. So we definitely want more people reaching out. And if the health minister hears from 200, 300 people on one issue, it's going to get his attention much more than one organization writing to him. So always better. And always follow up your letters with a phone call. Write your letter and then follow up the following, like a week later, saying, hi, did so-and-so receive just following up my letter. And always ask for something in your letter, ask for a meeting, ask for a follow-up, ask for a, please let me know how this goes, urge for something. Don't just say, I'm writing to let you know. And CCS in, if it's okay, so we've had, for example, in the vaccine hesitancy, okay, so we've had 600 people write to the health minister. So that we can include that and we can know, and we can write to the health minister and say, we've had 600 of our members write to you. That's very good for us. And use social media. Government love social media. They love being recognized. They love, or sometimes not, if it's a bad thing and they're not doing something right, they hate social media. So it's really good to, tag people, tag the government, tag departments of health. It gets them recognized, but it also gets them following things and seeing what's going on. Get your networks on board. It's a really powerful, it can be a really powerful tool. And we can actually make change. And even if it's like, I only have a book club and that's it. That book club can be really powerful. You never know who in your network knows 10 other people who are, or even one other person who is actually very effective on social media or letter writing or something else. So it's actually, think bigger. That's how I always think. Like, if you see something we're doing and you think, we could be doing it better, or you can do this and it could be different, let us know. If you think we should be reaching out to somebody who can make a big difference, let us know. We want this to work, right? We want to do, everything we do is for the betterment of patient experience and patient health. So yeah, we don't necessarily expect to be doing the best always. We're doing the best we can. So if you see something that we could be doing better, let us know and help us. Yeah, that's, and thanks. Like, if anybody, do we have any questions? I guess is my last point. If anyone has any questions, I'm happy to take some questions. No, no questions? All right, I think we're a few minutes early. I will say that you can go to our website. Obviously, I try and keep the advocacy updates pretty updated in the advocacy section there. As I said, the plasma, or no, the plasma-free zone for Hamilton, that city council meeting is happening on Monday. If you know anybody in Hamilton who wants to go to the city council meeting, please let us know, and we'll give you more details. But our chair, Christine Duncan, will be there and will be addressing the city council. Or if you know anyone in Hamilton who would like to write to the city council, please let us know. But that is a big issue for the community as a whole. If you want to get involved with any of the issues that were outlined. Oh, there's a question. Where are the new plasma centers located in BC? Says Jan. Well, currently, Jan, oh, this is, you know what, Jan, thank you. This is actually a really great question. So currently, just stop sharing my screen for a second. Currently in BC, we have plasma centers that are Canadian Blood Services plasma centers. So if everyone's okay with this, I'm just going to be get into the brass tacks for a second. As I said before, Canadian Blood Services their plan is to increase our plasma supply from about 15% to 50%. And then we would buy the other 50% on the global market, which is great. I mean, that's a really good plan. In order to do this, they need to open more plasma donation centers, right? More plasma collection centers. Their current plan would have Canadian Blood Services open a number of plasma collection centers. The Canadian Blood Services plasma collection centers would be voluntary, non-remunerated centers. Those centers would collect enough plasma to get us to about the 25% mark. They've entered a deal with a Spanish company called Grifols, and the Grifols would open another group of centers. The Grifols plasma collection centers would compensate donors. Those centers would operate for Canadian Blood Services. All plasma collected at the Grifols collection centers would be fractionated and go to Canadian Blood Services, and the plasma would stay in Canada. And those centers where donors would get compensated would bring us to another 25%, which would get us to the 50%. That's the plan. So far, Canadian Blood Services has opened a center in Kelowna, a collection center in Kelowna, a collection center in somewhere outside of Calgary, 3 centers in Ontario, like Orleans, Vaughan, Windsor, those are Ontario, and Grifols is planning on opening 3 centers, first one in Hamilton, Cambridge, and Whitby. And the one in Hamilton is the one that is currently being planned to be stopped by the mayor of Hamilton. All the provinces and territories have agreed to the plan set forth by Canadian Blood Services, except for the province of BC. So the province of BC is allowing Canadian Blood Services to open their centers, the voluntary centers, but they're refusing to allow Grifols to open their compensated centers that would operate for Canadian Blood Services. So there will be no Grifols centers in BC. So only Canadian Blood Services centers will be in BC. I hope that answers your question, Jan. But right now there's a center in BC in Kelowna, and there is plans for one to be in northern BC, but I'm not sure where. Wendy asks if we have a standard letter we can use. Do we have a standard letter that can be used? Yeah, we can send you some letters depending on, I have a couple, depending on the issue, but we can absolutely put some up in the advocacy area. I can do that next week. And then do we have any slides or videos? I do have slides and videos, Wendy. I have some slides and videos for just about us as an organization. And I have some slides for people to use in community groups just to let you know who we are and what we do. I'm happy to share those, anybody who would like them. And then we have a guest who says, do you work with IBD patients? We don't. We did work, we have a partnership with Crohn's and Colitis Canada, and we have done some work with them in the past, especially around fecal transplants, but we have not worked with IBD patients other than that. We do have a large portion of PI patients who have GI issues, which is why we worked with Crohn's and Colitis Canada. And I do know, I mean, I'm assuming obviously because of the GI issues surrounding PI patients that quite a few of them probably do have IBD. Jen says, thanks. And Wendy says, I've been asked to present to our local community. Do we have any flyers? We do have flyers. I don't have them at my desk, which I probably should, but we do have flyers, Wendy, and we'd be happy to supply you with some. We have one flyer about us as an organization, and we have one flyer about immunoglobulin replacement therapy. You can download them from our website, but I can also send you some in the mail. And that goes for everybody. Anybody who's interested in sharing more about what we do as an organization, we have flyers, we have slides that we're happy for everybody to get involved, and we'd be happy for sharing it. Nancy says, do people get paid much to donate plasma? Nancy, that's a really interesting question. The issue of compensation has been, this is another really interesting, controversial topic, but we're happy to talk about it because that's what we do. It depends on where you are. So donating plasma and donating blood are very different. The needle to donate plasma is quite bigger than the needle to donate blood, and it takes a little longer to donate plasma. And the topic of compensation it varies from where you are. So if you're in, I think it's Czech Republic, you get paid about 12.5 euros, which is really, $10 to donate. If you go to the States, I think you get a Visa gift card with like $50. I'm not sure, but it does vary clinic to clinic. There are a lot of paid clinics in the US, so it's very different. Because the US supplies about 85% of global plasma, but only uses about 20. So it's very different. In Canada, because we only have one clinic that compensates plasma users, and it's been in operation for about 20 years. It's in Winnipeg, and it supplies a specific product. So they're the only ones in Canada they've been given compensation or dispensation to compensate. And I don't even know how much they compensate, to be honest. So this has been a ongoing battle of how much would Canadian patients be paid to donate. The argument is, and in Canada, is, well, we could compensate in other ways. We could offer tax incentives. We could offer days off work. We could offer something. If it's a university, you could offer a tax break or some kind of gift certificate to the bookstore, to the campus bookstore or something. So there are other ways that we're looking at, or have been discussed on the table. I think it will end up being a Visa gift card or something like that in the Grifols centers, and it probably will end up being about $50 to $75 is my guess. However, there are other ways that people are looking at compensation. So we'll find out and see. Wow, thanks everybody for all your really great questions. But again, there are so many ways to get involved in our organization, and so many issues. And if there is an issue or something that I did not mention, but that is in your area or something that you see that you would like to get involved in, please reach out to us and let us know. There's no way that we can be everywhere and know everything. So if there's something that you think, this is an issue, for example, the nurse in the Atlantic, we didn't know about that. The clinic had to come and talk to us about it. The physician in Saskatchewan, we didn't know. The clinic came and told us. Actually, it was the clinic in Alberta that came and told us. So there are issues that we are unaware of, and we'd really love to be able to ensure that patient experience is equal and also to a high standard across Canada. And we can't do that without our members, because we just don't know what's happening everywhere. So if there is something that you think is important and you would like to see a change, and come to us and let us help, and let's make our voices loud together. So yeah, please let us know. And if there's something that you would like to get involved in, let us know. Wendy, feel free, email, and we will get you the information you need to present to your local community. Again, thank you all so much. And feel free to email. The info email is there, but you can always email me directly. It's Whitney at immunitycanada.org. And follow us on social media if you want to as well. We'd love it. And yeah, again, we'll make sure that stuff is up on the website. This has been recorded, and the recording will be sent out to all of you who registered. Again, if you have any questions, please let me know. But in the meantime, thank you so much all for joining us. It's been a real joy to be able to share some information with you about advocacy work and our advocacy work during this special World PI Week. I hope the rest of you enjoy World PI Week, and thank you to all of you for your work, and we appreciate all of you. Bye-bye.